And now that's kind of taken out. So that's a good half a day of work that I've been able to save just by opening it up and looking right at it. It's really nice to do that.
When practices are efficient, they are more likely to succeed and in turn grow into the organizations they want to be. That is why eClinicalWorks places a priority on efficiency of practice management. One of the key tools available to practices today is the Practice Growth Management Dashboard, which is a free tool that is available to all eClinicalWorks customers. And here to speak with us today about how this tool is starting to improve efficiency in their organization is Dr. Stratta, CEO and CMO of Hyndman Health in Southwest Central PA. Dr. Stratta, thank you so much for being here today.
Good morning, Adam. How are you doing?
I'm doing very well. Thank you, Dr. Stratta. And we're so glad to have you here today to talk about your experiences. Tell us a little bit about Hyndman Health before we get into the Practice Growth Dashboard.
Hyndman Health came out of a very small town in Southwest Central PA. Hyndman, Pennsylvania, actually came out of 2 FEMA trailers because of a flood that hit there and the emergency people that came in to help the community. The community opted to keep the trailers. One was medical, one was dental, and eventually developed into a building down there. Moved into the Bedford area, which is a smaller town, or actually larger than Hyndman, but still small, a little bit north of Hyndman, in about 1990. FQHC certified in the 90s as well. Since that time, we've expanded to 3 other sites as well as a mobile unit, and have almost tripled our patient contacts within the last 10 years of what we're doing.
So I think it sounds like you are a perfect candidate to talk about practice growth from that story alone. So Dr. Stratta, you have started to use the Practice Growth Management Dashboard. How did you hear about this? Where did this start for you?
We've been using eCW since I came on board with Hyndman back in 2019. The growth was really huge, amazingly, during the COVID years. And I needed a whole lot more robust data than what I was getting when I first got here. I worked with eCW and getting more programs into our system that we could use. One of which I was really looking for was the canceled, no-show, rescheduled visits. Just try to get an idea of how much money are we potentially losing because of these people who are no-showing or canceling. Not so much reschedules, because those are obviously are people who come back in. Used to do it very manually. Had to go through one of the EBO reports and then data mine on my own. And I was talking to our product manager and asking him, okay, is there something else available that's going to be able to help us? And he mentioned the Practice Growth Dashboard that we've now been using for the last couple of months. And helping me with those reports in particular, which is where it initiated, and now we're expanding into the other aspects of the dashboard that's there.
All right, sounds good. So the Practice Growth Management Dashboard, for anyone who doesn't know, as I said in the beginning, it is a free utility. It's included with eClinicalWorks. And I think it actually has recently gotten a facelift, and some of the visuals are a little bit more interactive and cleaner as well. What specifically, you mentioned something about the no-shows and things like that. Talk to us a little bit about what does that dashboard look like? What are you searching for on there that you didn't, that was hard to find before?
Yep. With 5 sites, I wanted to get an idea, was it a site issue in which the no-shows, cancellations were coming on board, or was it a provider issue? What was it? Looking for data. And again, before the dashboard, I would have to go through each month, go into Excel files, do some data mining there. The dashboard now has a 12-month running graph that shows month-over-month comparisons of the KPIs, particularly the cancel and no-show visits that we're looking at. And then it's also got an EBO button if I want to dive into the report for each month. Like I could hover over, say, March of 25. We're at a cancellation rate of 10% right now. I could hover over that bullet point and then open up that EBO report for that bullet point and then look at the data from there. So I could still data mine if I want to, but it gives me a good idea of where we've been trend-wise. And I'm a big trend person, wanting to see what we're doing month over month. And that's great for my board too. The board always wants to know what we're doing, and it's been pretty tough for them if I throw up a Excel file with 9,000 different visits, they're going to get lost. So now I can show it on that graph that's right there, and they get a better understanding of what we're doing as a whole over the last year.
Talk to me about how that's bringing some efficiency to you. What kind of time did you spend trying to come up with this information before versus now that you have this dashboard?
I would spend a good half day or more getting the data. Certainly, sometimes we're victims out in rural communities of our internet capabilities. So some of the days are waiting for the internet to catch up. Other times are just pulling the data and then bringing it over to Excel and then data mining into it just to get the percentages alone. Sometimes I work really hard at that. And now that's kind of taken out. So that's a good half a day of work that I've been able to save just by opening it up and looking right at it. It's really nice to do that. If I want to go into it, I can, especially if I see a blip on the KPIs, I'll do that. But it's just so much simpler now. We just pull it up. I could take a screenshot, put it up on a PowerPoint presentation, and give it to my board, and they can look at it real quickly. And it's just so much smoother for us this way.
And what kinds of things are you seeing? What kind of trends? You mentioned watching the trends before. How is this pattern changing? And what do you do, or what have you done when you've noticed some of these blips or anomalies, like you've said?
The nice thing when you look over a 12-month trend is you could actually see where those blips are really quickly, almost real time. And I could look at that and look at the month and then try to make a analysis of what happened for cancellations or no-shows for that month. Case in point, February, just this last month, was a blip up from the previous 4 or 5 months. And I know from what we've seen in our area, flu has been devastating to the area. Even though you had flu shots this year, flu has just been really strong. And I know my staff alone have been absent half of the month. So I know a lot of the patients just canceled because they were sick, which kind of doesn't make sense. If you're sick, come to the doctor's office, but it's the way the community is. If they're sick, they stay home and they call. Another case in point is August of last year. It was a blip again, looking at the 12-month running. And it's, okay, what's happening in that month? I could look at the EBO report, but necessarily I don't have to, because I know in August, that's a vacation month. At least in my staff, a lot of my staff have kids, so they're off that month. That's a month they take off to go with their kids. Same thing for the community. Community also leaves. And, patients have appointments. They think about canceling an appointment after they're on vacation. So they realize, oh, I got an appointment because we sent out reminders, and then they cancel because they're out of town. So I have a much easier way to look at a year running for, again, cancellations, what I have up right now for KPIs I could look at. And I can show that to my board, and I could tell them, okay, this is what's happening on these blips. Other times we're fairly stable. We have a little variance, but overall we're pretty stable across the year.
Well, it's great to be able to see the trending for your own information, but how do you know whether your metrics are in the right ballpark for an organization of your type or in your area?
Used to be just pull it up on the web and try to find a number somewhere. Nice thing is at the top of the practice growth dashboard now, they have the goal type of our overall average, and then they have an average in state and an average in practice size. So I could compare from for those 2 bullet points to ours and see, okay, are we falling within range or are we out of range? And for the most part, we're pretty close in range, except for those last couple months I just talked about with the cancellations. They were a little bit up, but we get a good idea of comparisons. From an FQHC perspective, I have to take probably a little bit further, because I do know the average in state is all practices, and FQHCs we're just a different breed as compared to private practice. But I could still extrapolate that with the board, and the board understands it. The board knows who we are as comparison to regular practice.
Well, maybe there's some room for the product management team to implement some enhanced benchmarking to get even more specific about practice type and things like that. Maybe we'll see some of that in the future. So, Dr. Stratta, we talked about practice growth. We talked about the visibility, the transparency, the ease of drilling into that data and seeing what you need to do. What are some of the other ways that Hyndman Health is looking to improve provider and staff productivity?
Financial health has been important to me ever since I became CEO almost 2 years ago. Incorporated a finance committee. We've got AR reporting much more robust. And AR is just the same as I was with the cancellation no-shows. It was a very manual process. They would get the data, and then they would have to dig into it. I've just started getting my financial team working on that, but the dashboard for financial health has exactly what we've been doing on a manual basis, the days in AR, AR over 90 days, clean claims. And again, you could dig into it and see, okay, what's falling behind it? If the days in AR are going up, what's driving that? Is there a certain bucket that can do that? But it's time saver from the fact that you could look at that and see, okay, I got this in the green. I don't have to pull up the chart data and dig into it to find out if it's a positive or negative. I know it's positive, so we'll move on to something else that's more important. Good savings about half the time they spend probably looking at that stuff.
Well, it's good to hear that the Practice Growth Dashboard has something for everybody. And if any of the practices that are watching today's podcast have more questions or want to see the Practice Growth Management Dashboard for themselves, make sure you reach out to your business development contact at eClinicalWorks. If you don't know who that is, you can always call or log a case and we'll be happy to connect you. But they are the best people to help you get a view at what this Practice Growth Dashboard can do and get that set up for you. Dr. Stratta, I just wanted to say thank you so much for the time that you took here to share your insights today. We're lucky to have you.
Always happy to help out, Adam. Anytime you need something, let me know. If I can help out, I will.
Thank you very much.
Thank you.
Don't forget to check out our other eClinicalWorks podcast episodes on YouTube, Apple Podcasts, and now platforms like Spotify as well. And of course, you can always catch us on eClinicalWorks and my.eclinicalworks.com. Also, make sure you reach out to your strategic account manager or your business development contact to learn more about all of the new features available in eClinicalWorks today. And of course, if you like the content that you saw here today, make sure you subscribe and that you share this content with others. For the eClinicalWorks podcast, I'm Adam Salati, and thanks for watching.